Actually, it was when I was a high school student, I had this dream of restoring art, just, like you would help a patient heal.
I was the little 4-year-old carrying around the dolls with a stethoscope and Band-Aids.
I really kind of think medicine may have found me.
My wife and I were looking at some old high school yearbooks. I had signed it B.J. Varghese, MD. So at some point, I had already decided that that's what I was going to do. Okay.
I am a pediatrician,
pulmonary and critical care board certified physician,
family medicine and sports medicine specialist,
plastic surgeon and craniofacial surgeon,
an obstetrician and gynecologist.
A medical career is not for the faint of heart.
I'll put it very simply, it was the best of times and it was the worst of times.
Med school is hard.
A lot of all-nighters.
Packed my snacks and I brought my books. Basically lived at the library on the weekends.
Medical school was amazing for me. Every day was a gift.
It was my first real experience with the intensity of medicine.
I was a resident during the 1989 earthquake. I was in the intensive care unit, rounding on patients, and then in 5 minutes, our entire world changed in San Francisco.
I was an active duty emergency physician in the military for 7 years.
I've been practicing for 17 years. Nothing was as intense and such a change in the normal routine of medicine as COVID.
Suddenly, we were being asked to do things we had only read about in textbooks.
medical school and residency and fellowship. This is the moment that all of that has been for.
It doesn't really fully hit home until you see individual patients and their families who are very directly impacted by COVID.
I try to treat everybody as if they were my own family. I always keep thinking, well, what if this was my mom? Why would I do different?
They are somebody's brother, somebody's husband, somebody's daughter. We are all in this together. We have to be together. We have to fight this together.
It was truly an honor and a privilege to be able to take care of these patients who were so ill and to offer some sort of comfort to the families who could not be with their loved ones.
The pandemic has been a sharp reality, and so we use our experiences to forge the way ahead. That forging ahead, it gives me great hope.
Try to be kind. That's something that my wife and I always teach to our children, be kind. If we're not kind to one another, how can you connect with another person?
Human kindness has to be the start of medicine.
Being able to relate to the patient and feeling what they feel.
It shows so much more character to be kind.
Without human kindness, I think you're missing what medicine is really all about.
Being a doctor is who I am. So what does it mean to me? It's everything to me. It is my identity. It is my joy. It's my passion.
You are my